Within 3 years, we're now at 60% adoption of projects being touched by AI-driven neural machine translation in some regard.
And welcome to SlaterPod, everyone. Today, we're really excited to have Nick McMahon on the podcast. So Nick is the CEO of language service provider United Language Group, ULG, one of the top 20 global LSPs with over 80 million in annual revenues. Hi, Nick, and thanks for joining.
Yeah, nice to meet you. Thanks for having me.
Absolutely. So where does this podcast find you today? What country, what city?
Portland, Oregon, which is actually my hometown, home city at this point. So it's very nice to be here. It's not often I am, but I'm very glad to be here.
We're sending somebody to Portland in, September, because the ALC conference is in September. So we're going to be there.
It's a really nice city. Like, despite we get the news, we're a very liberal city, and so we've had a lot of different challenges around public unrest, and there was a big move here during the pandemic, and they shut down the federal courthouse. So we got into the news for all of the wrong reasons, but actually it is a great city, and it's coming back strong, and we're starting to get back to our old habits. And so September should be an awesome time for people to come here.
All right, Nick. So you've been in the language industry for quite a bit of time, and you've worked with VIA, SDL, Yonkers, Lionbridge. Tell us a bit more about your time in the language industry and how you came to lead ULG.
It's been a very interesting journey, right? So I started off as a junior project manager for SDL, right now, obviously part of our RWS. But all of it ultimately was sort of accidental. I didn't really know what I wanted to do when I left university. I liked buying things, so I got a job buying things. I went into procurement. And then the guy next to me was in project management. And he seemed to have a really easy life and relaxed. It was a very different industry. And I was like, wow, that project management job looks awesome. So I looked for a project management job. And I got one at SDL and, under Mark Lancaster and Dominic Kinnan. And then from there, it's just been, Uruguay is a very good industry. You get involved in a lot of different cultures, a lot of different languages. I've got to go to a number of different countries. And it's been a really, really good industry. And I've just managed to sort of navigate through the various stages. I was project manager, account manager, senior account manager. I was in charge of national sales for the US for SDL. And just one thing sort of led to another in terms of opportunity, the industry brought to me. And I was lucky enough to be in the right time at the right place and get the opportunity to progress right through to becoming CEO of ULG.
That's amazing. Junior PM to CEO of an $80 million company. So to all the PMs that are listening,
you can do it.
The sky's the limit. So then tell us more about ULG. Probably the extended elevator pitch, because it's not a startup. So just tell us more about the company. Where is it based? Kind of key tech, key services, key value propositions, sectors, etc.
There's obviously a lot, right? It's not like we're a huge company. We're relatively complicated at $80 million. So there are a number of different things we do, but effectively, it's language and cultural solutions. And I think, when you start thinking about where the industry is going and what is the evolution of the industry around AI and, all of those topics that a lot of people, are touching on right now, it's the concept of language and culture. And we try to connect language and culture to create more meaningful outcomes. And so for me, language has always been a proxy to the end goal, right? It was, we have an internal analogy that we give is, it costs $1 million to do a Super Bowl ad. So how much of that $1 million went into putting it in English, right? And the concept, of course, is none of it was in English. So that's $1 million on engagement and cultural connectivity. And as an industry, because language has been so expensive and complicated and difficult, and as a project manager, I worked on many projects that were complicated, difficult, time-consuming. By making getting it into English the hardest thing, or French or Japanese, my ability to really then connect and engage with my audience or focus on the outcome diminished, because I had to put so much effort into getting it into language. So it's like I take that $1 million Super Bowl ad and I charge you $970,000 to put it into English. And then you got $30,000 to do engagement and connectivity. And I think as a company, United Language Group, that's what we try to go beyond words alone, right? And we try to go into outcomes and cultural connectivity, because I think that is ultimately what people really want when they think about language. They really want to connect, they want to engage, they want to build accessibility and bridge gaps.
You mentioned accessibility, and also maybe can kind of segue to the language access topic in healthcare, because I know that healthcare is a big focus of ULG. So tell us more about the healthcare business, but also for those of us who are not very familiar with the super complex and super large US healthcare system, what parts of the healthcare system are really driving LSP demand, and how is ULG kind of meeting that demand?
I feel like every time you ask me a question, it's probably an error on my side. I'm blimey, there's a lot in that question, Florian. But effectively, so there's a couple of things. One is from a ULG perspective. The way that we look at it is that we are, we do different verticals, right? We have legal, we have enterprise, but a very interesting vertical is what we would refer to as the welfare cycle of non-English speaking communities. So if you sort of think, from a cultural basis, you come into a country, whether that's in the EU, or it's within the US, you bring along with you not just a language, but you bring a culture. And there are, we refer to it as a cultural node network, and there are different elements on that network that influence your behavior. So, I'm English, and even today I look at the BBC. And so it's a source of data and a source of information for me. For whatever reason, I've chosen to trust as a point of data. But that's part of my cultural node network, as there are different things that drive the way that I interact and engage with different services community. When you think about United Language Group, we're welfare. It's the welfare cycle. So educational systems, we do a lot of education. Cities and states, we have over 1,000 city and state customers. Social benefits and welfare, we cover all social benefits and welfare for a national level. Healthcare providers, insurance providers. So every single aspect of the welfare cycle as a non-English speaking immigrant or citizen of the US or the EU, we cover that group. And what you start to see is access and equality in many aspects within community is ingrained within system and process. And so when you start to think about healthcare systems or medical device systems, transparency, do you really understand the services that are available to you? Do you know how to access them? Do you know what they entail? Do you know the risks involved? Safety. Are you really taking, do you really have the right level of information and support to really understand what type of risk you're taking as an individual by pursuing some of these solutions and services? And then also privacy. It's huge, especially when you've got such a complicated US healthcare system, involves billions and billions of dollars. Your information and the passage of your information can have a profound impact on your cost of insurance. As a healthy family, I pay about $1,600 a month in healthcare insurance between my contributions and the company's contributions. It's an enormous cost. Yeah, it's crazy. From a European perspective, when I moved to America, you just can't believe it. So if suddenly there's a piece of data around me because I got involved in a clinical trial, or because I took a certain sort of medicine, or because I had a certain sort of procedure, that information going through can have a radical impact to the future cost of those services to me on an ongoing basis. And so patient safety, transparency of information, and then privacy of data are three massive driving forces within healthcare, but also the broader welfare bubble that sort of all of these things come together in.
And within that, you do both translation, like written translation, but also very heavily in interpreting, right?
That's right. Yeah. So we hear what patients are concerned about when they're dialoguing and communicating with insurance providers or healthcare plans. We see what healthcare plans translate and the support materials. So let's say I translate a bunch of diabetes content. I also have the data to tell me whether diabetes is actually a concern on the phone and in dialogues and communication with those healthcare providers. And when you think about an outcome, availability of that data and support material, as well as what, how it's used, how it's, is it visible to an individual, and is it the right content, has a dramatic impact on the outcome of that patient.
And when you work with kind of the municipalities, the cities, versus the more private sector in the US, healthcare providers, like what are some of the key differences? Maybe starting with I don't know, public sector RFPs versus private sector RFPs and then delivering the service.
I'm bashing your question a little bit. The RFP is like literally the least interested in the entire cycle. So RFPs generally, they're always way too long for everything, right? Every now and again, we'll get one that is very focused and really talks about a need and a challenge. And it's super useful from an LSP's perspective because you can be a lot more specific. Most RFPs are like, tell me everything about everything. Oh, and that's a good question. Let's add that too. Governments are even worse. So if you've got 60 questions on a private sector, when you go to government, you might have 600 questions. And they're really just trying to cover every single base. But I think where it gets interesting is that ultimately everybody looks for how do I engage and get a meaningful outcome. That's what they want to do. When they ask these questions, what they're really trying to do is how do I build my French audience for Dyson, like as a Hoover manufacturer? How do I build my Japanese audience for a tractor? You know, we work, very, extensively with John Deere. They do a lot more than just tractors, but that's what they're known for. And then, also, how do I make sure this immigrant finds a home and meaningful welfare and support within a city? So engagement is a common factor. I then go out to RFP and go, I don't really know how to engage a person. So I'm going to ask you a bunch of questions around translation, but I really want to engage that person. So then when we sort of do it, we start off with healthcare outcomes and we start to say like, okay, interesting. Like, when you say to somebody, please take this pill, they don't take the pill, factually. And then you say, okay, like, please have a follow-up visit. Follow-up visits for non-English speaking patients are something like 10% of the follow-through rate of English speaking patients. And so why don't they? You've translated it. You've asked them to schedule the visit. Why don't you? And it turns out that it's within this cultural node network that defines the fact that they have concerns or previous experiences or doubts about the US healthcare system. They have financial issues around the US healthcare systems, educational issues. And you start to realize, the cultural node network really has a dramatic impact on the way and what you translate and how you approach them. So for instance, in healthcare, we start to say, rather than you should take this pill to get better, Florian, we should say you are a meaningful source of income for your family. And for you to retain the value and long-term earning potential of you as an individual, you need to take this medicine so you can continue to work and support your family. And for some cultures, that's a vastly more effective message, which means they take the pill.
It's like working backwards. Like I wasn't familiar with this way of looking at it in this particular context, but of course we're all like hyper familiar in the sense of marketing, right? You're looking at what do you want people to do, and then, well, if it doesn't work across cultures, you're going to kind of reinterpret, transcreate the message to make sure people, have that desire, or you push people into that desired behavior. Now you're taking it in the healthcare space, so this is a much more kind of advisory approach to the client, as opposed to, what you just said, just doing the translation. Like you will have to be aware of all these concepts and these cultural differences and then advise the client to, adjust the language accordingly.
Yeah. And what we found is on the enterprise side, you start to sort of think, wait a minute, like everybody wants engagement. So we started off with healthcare and we're like, oh, okay, that makes a lot of sense. And we got 4 times member signups. So a very large global healthcare provider or national healthcare provider, but they are a global organization, the largest in the world. In fact, tens of billions of dollars. They're struggling to get a community to sign up with them, right? And a non-English speaking community. We changed the messaging. We changed the way that we distribute that content through a different media outlet. We then do meet and greet with trained resources to talk them through the options of their healthcare plan and why it's worthwhile to them from a cultural. So their first point of contact is in culture. 4 times the rate of member adoption. So we're like, wait a minute, like that's a big shift, right? That's really started to change the dial. Rather than just providing this translation, we were like, okay, we could change the nature of what they were trying to do to create engagement. recently we sort of like looked at this concept. If you're selling tellies in America, you do July 4th and Super Bowl. If you want to do that in Mumbai, Mumbai buys on feature and function. So and then maybe in the old days you'd be like, oh, maybe it's sort of transcreation, but really it's like, do you have the right content and materials before you do the translation and the outreach? Do you have the right materials and the right content to do engagement and involvement of the audience, the target audience?
And then who does that within the org? I mean, is it kind of a solution architect role that would take the brief from the client and then like proactively propose some of these value add solutions? Or
it's very interesting. So is project managers and program managers and solutions architects. So it's a team. When you look at something, basically we need a group of people to come together to like look at the different aspects of the requirement. And I would say honestly, just to be really transparent, it's not like this works and is awesome, but we're probably about 30-70%. So 30% of our people now start to look at solutions and how to create language solutions around engagement and interaction. And 70% of stuff is still really, yeah, it sounds awesome, but we still would like you to translate that stuff.
It's always the case, but you gotta proactively go out and tell the clients that there could be more, right? I wanted to ask you about this. I'm not sure if you know a lot about this, but I keep hearing HIPAA compliant and HIPAA compliance, and in the context of translation, again, not being US based, sometimes I'm wondering what that is. Like, is it a thing in the language industry, and in what way is it a thing, and in what way does it or does it not drive demand?
It's wrapped up, and you'll see a lot of similar proxies too in life sciences, but it's wrapped up with is the transparency and patient safety. And so basically, a good example, but it's actually medical device. So it'll give you a sense of what's happening in HIPAA 2. But like you have to give in a clinical trial, like you have to give a sort of guidance of what's actually happening. What are the actual results? And then there was a new requirement from the UA that you have to give like a lay perspective of that, right? So because like otherwise it's like drug XXXYYYZ54 was tried on 54 trial patients within this ethno-demographic, right? And you could read like the 54 pages of regulated content. You're like, what does that mean, right? What they really need to do is sort of say like, hey, we think this can treat liver cancer, but if you take it, you might die, right? And they need to give a much more simple version of the risks and challenges involved in a process. And so when you look at HIPAA and you look at support for within the healthcare industry at large, they're trying to be more transparent and provide greater detail around what's happening to your data. Where does that data flow? Who's using the data? Who has access to the data? And then they're trying to provide that level of transparency so everybody within healthcare can start to get a bit more of a conscious decision about managing their healthcare decisions and having access and control over their healthcare data, so that it's not basically effectively becomes used against them. Like it's interesting, like somewhere here on my desk, I have like 23andMe, the DNA test, and I got it for my birthday a year ago, and I still haven't processed it. And I would like to, because I really want to know, my background, and I love culture and all of that stuff. So it's fascinating to me, but I'm still like, ooh, but what happens when they tell me all my healthcare data, and like, who's going to get it? And is it, and I think it is very secure. They're a very robust company. But humanly, it makes me nervous. And HIPAA regulations are required to make sure that informed consent documents are clear, like you understand it, what's required, and then increasingly, and this is a good link back to your question on the public sector too. Companies want to do the right thing, right? Healthcare companies, they really do. They want to make patients better, but the problem that healthcare companies have is that they have 80 English-speaking patients that are American, and then 20 other language groups. And so the prioritization keeps getting pulled down. The government sees that there's disparity around COVID, right? They see negative healthcare actions with HIPAA, with the EU regulations around medical device labeling and things like that. You see this move from governments to say we actually need to prioritize it and change the priority in society. Because if we keep leaving it up to the entities, it's not that the entities don't care, they do. I honestly do believe they care, but it's a priority number 6. So the reason you're seeing regulations, and it's fascinating, and also like we've had like a 300% increase in like grant work, because governments and city entities are going to force accessibility, transparency, proper, realistic, honest data. They're going to force that through regulations into, the healthcare sector.
What do you mean by grant work?
What happened, and everybody knows this, but what happened in COVID, right, is it turned out the people that don't speak English were getting stiffed by the system, right? Because they didn't have access to information. The information wasn't clear and transparent. It wasn't detailed. It wasn't depth, right? And from years, I know from years like in the translation industry, I still think it's like 5% of content is translated. It's some ridiculous amount. In healthcare, and welfare generally, that matters quite a lot, because when there was a public health emergency, all of a sudden, people were really not getting equitable service. And that led to inequality in terms of deaths and negative outcomes. I mean, it was a very serious thing. So then the government starts to look at it and sort of says, like, we need to improve data. We need to improve transparency and data availability. And that's the regulatory stuff you're talking about. But they also say, well, like, wait a minute, we should look at why. Like, why is there disparity? So part of the reason for disparity is that you need someone to help you navigate healthcare programs. But who pays for that navigation? Who pays to inform, a Latino community in Florida about what's really available to them and how to navigate a healthcare plan when they've just come to a country where they didn't have private healthcare, and all of a sudden they're like, oh my God, like what is this? The government will fund that through grants, and the government will look into how can we bridge these gaps? What available technologies or what available solutions are there to bridge these gaps? And they'll put very real money behind bridging accessibility and equality gaps in a way that private entities, they would like to, and they do fund some of it, but not with the same priority that they fund, the 80% audience or the general audience.
And so this is in the US, it's funded by really city level, kind of sub-state level, or maybe state and then below.
Biden too is put in language access support too. So it's so basically you can go in and look for state and national grants, and you can pursue those state and national grants. And in many ways, they provide a very meaningful source of bridging inequality. But you've got to want to solve inequality. You can't make money on a grant, literally, you can't. But what you can do is you can bridge equality, and you can sort of create services and support. And what we found commercially, just to be really clear, is if we do the grant work, it provides a basis for a better and deeper understanding of the overall inequality bubble, which we can then get more commercial value with private enterprises.
Let's briefly talk about technology. I know you have your own TMS. You call it Octave TMS. Can you just take us a bit through for lack of a better word, the stack, TMS, CAT interface, like translation productivity interface, machine translation, and maybe if you want to also branch into the interpreting side of things, just walk us through a bit how you solve the tech problem there.
I don't think that's the tech problem, right? So workflow automation is super useful and super important, and then integration of workflow automation is super good and super important. So if you've got a bunch of stuff you're translating, the amount of manual processes you can remove from that help greatly, because it increases the efficiency of a translation cycle, which hopefully would then empower you to spend more time on the engagement activities. Right. So every company, if they're not at engagement and they're really still like, hey, I just spent $1 million on this advert and I'd like you to translate it, or $1 million on this content and I'd like you to translate it. You want workflow automation, because, certainly in a top 20 level, like every single person is going to have some level of workflow automation. And in interpretation, you have a call management technology. We use in Contact. NICE in Contact is a third party software. But basically that allows you to connect to everybody on an automated basis. You got to connect within seconds, to thousands and thousands and thousands of calls. And so you need, a technology that does that. You also have workforce workforce management systems that look at, the demand for Spanish interpreters like every 5 minutes. And then sort of, can say like, hey, you've got to find some more interpreters and bring them onto the platform. So, but they're really table stakes. If you're a small scale company, VIA, we were at like a $12 million company, sold into ULG. Developing something like that is a big deal and a big step. Top 20, you must have workflow automation. I can't imagine anyone could operate without workflow automation. And then also translation memory. I think AI is the interesting, technology, right? It's the thing that starts to drive a very interesting change and movement within our industry. And so I think, that's the next level of unlocking. But, Octave is awesome. It's a workflow. You should definitely use our translation management system versus all those other guys. Their workflow stuff is rubbish and ours is awesome. But it's really table stakes. It's not, you should automate your workflow and you should integrate your workflow. And that makes a lot of sense when you've got regularly requiring translation or interpretation jobs. But it's not, I don't think it's really going to be the stuff that changes moves the dial for an internal language group, or for someone that's trying to engage and connect with a global audience.
What's not yet table stakes is LLMs and ChatGPT. What are your thoughts on that? Like, for us here at Slate, it's been quite the ride for 6 months trying to figure out what it is, what can it do, what will the impact be? What are you seeing out there in practice and production?
I always think it's the problem, like, may you live in interesting times. I'm like, whew, I feel like may I live in slightly less interesting times right now. Like, I mean, I read a thing the other day that significant people, including some of the Google developers, signed up to sort of say that AI is an existential risk that could lead to the extinction of the human race.
That one's a little odd. I got to say, that's a little crazy. Yeah.
It's crazy as an individual to suddenly see it. And for me, and you've probably lived through a portion of this too, right? So before AI, less than 2% adoption. So like, and I my head is like 3 years ago, less than 2% adoption of machine translation for us, right? So there were niches. I think car user manuals were a great test example for statistical and rules-based, but it was less than 2% adoption. Within 3 years, we're now at 60% adoption of projects being touched by neuro-machine translation, AI-driven neuro-machine translation in some regard. And you think from a business change point of view, it's like, oh, like that fast. I've never seen a technology like be adopted in that rate and speed. In the early days, we have a dedicated AI team. I mean, it's awesome. And in the early days, we definitely trained the AI. It was no problem. Like, oh, super new, super bright, intelligent student, and we're training it. It trains itself. It's really a remarkable technology, and I do think it's going to create a sea change in terms of what's possible. When you start to look at ChatGPT 3 and 4, and you start to see the concept of, in 3, it's linear model, right? And in ChatGPT 4, I'm going to be able to do cross-general application of artificial intelligence and start to say like, oh, I can take something I learned about this other task and apply it to this new task. I think it's a revolutionary technology, and I think the concept of regulating it is very accurate. Like, I think somebody should stop and think about it and sort of work out, okay, like, how do we put confines around it? But ultimately, that's a longer conversation. But I think it's very worth thinking about regulations. For us, on a much simpler basis over the next couple of years, we're using AI. What AI can do for us is help to identify components that can allow the neural node network to be traveled from one culture to another. So we can start to say like, okay, based on conversations that are happening, what are the major concerns of the Vietnamese audience within Miami? And it can take a whole range of data and start to sort of give us guidance and sort of say, you know what, like, this is what concerns that target audience. And then that unlocks our ability from a human perspective to sort of say, okay, if they're the major concerns, how do we best interact with those major concerns and sort of try to find a balance? But AI can unlock the data and the concerns and give us guidance in terms of what's, how you can navigate this, cultural node network, has about, 60 different nodes in it. If you think about education, income, education level, history with a given, part of the welfare cycle, it can be very complicated. So if you're feeding it in all sorts of data, and AI is very good at unlocking that and starting to say, like, okay, like cross-culturally, this is what I think this is an area I think you can look at as an area of disparity. So I see tremendous potential with AI. It's very, very exciting for us. I think it can really shift the dial away from like, how do I get it into French, into what is that French doing? And for Vietnamese people, Polish people, immigration, across the world, is a very, very interesting area for us. So we're excited about it. But AI at a human level, I think it's fascinating. It's crazy what it's capable of.
It is. It is. I mean, I'm using it for all kinds of tasks, not really kind of like linguistic tasks in the sense that I don't use it for like summarization yet, or like, translation or anything like that. It's more kind of like more mundane, like reformatting or kind of giving me ideas tasks. So I wonder, how it's going to get used at scale, like with these volumes that we're dealing with in the language industry. Talking about millions and millions and millions of words. It's not like, I don't know if the API can handle this like just yet at a cost competitive level, right? All right, like we could talk about this whole ChatGPT for like a long time. It is revolutionary, and it is going to impact the industry in one way or the other. But so far, if you draw to the experience we had with neural machine translation, you said it. I mean, I remember back in my LSP days, it was like 1% or maybe 0.1%. That was like MT. It was like it just wasn't useful, right? And then with neural, you go to like 50, 60, 80% of your business going through it. So, I think the language industry is quite good at adapting to this. So I wonder how well it's going to adapt to this one.
The concept of translation, we've got to get the price point of translation down, right? And I'm not saying like, let's stiff all of the suppliers. Like, we don't do that. Like, we have a fairly good relationship with our supply base. No, but for us to get up to full transparency, full visibility, full engagement, and then the ability for me to move my focus from getting it into Japanese to be, does this really, connect with and speak to a Japanese audience? I need to get the cost of translation down in a very real sense, because then it can become, my $1 million ad, like let's say, and let's do something more realistic, right? Which we actually work with. We don't work with the $1 million ads, right? We do like learning content. So if I'm looking at my learning content, what I really care about is, does this connect to a Japanese audience who's trying to understand and engage with harassment content? Like, does this really speak to them? And does this give them an opportunity to provide harassment feedback? And am I engaging in the right way? And if right now, if I got my, let's say $15,000 to translate a learning course, that's $15,000 on translation. I'd much prefer to spend, $1,000 on translation and then $14,000 on perfecting that course and creating course, and then using AI voice to text to create the audio overlay to create a more compelling course in Japanese. And what we found is that customers are very focused on their core market, and there's a lot of value in their core market, and there's still new features, new benefits, and new content they can bring to their core market, but they kind of want to put the other languages for someone else to help deal with them. So if we say like, okay, we can adjust your course and we can make it more applicable or more engaging in that target market, that's a service they're still willing to use an LSP for, because they don't have their own internal Japanese team or guidance to give them that feedback. And although they do have a sales team, and in my when we first started, I was like, well, the sales team could do that. The sales team doesn't do that. The sales team sells the available product. So if you want to shift that product a little bit, we found a lot of people are pretty open to the idea that we could help them from a language perspective drive engagement. But to do that, you've got to reduce the cost of translation. And I think, for linguists and things like that, the more they can sort of think about, okay, you're a healthcare specialist or you're a heavy machinery specialist, how could you bring knowledge and awareness of that heavy machinery and the target market and the way it's sold and the way it's communicated? How could you bring more of that value to the table rather than, yes, I put it into, Polish.
Makes sense. Just want to briefly touch on kind of M&A and funding and all of that. In the language industry, half of which is kind of owned by either venture capital or private equity. ULG also has a private equity investor on board. How do you see the current environment also in terms of M&A? You did a few acquisitions in the past. Like, where do you think this is going? Does something like the LLM revolution make it easier or harder to talk to investors? And maybe if you can shed some light on your plans in terms of M&A going forward.
We're still a fragmented industry, right? And I think a lot of the investor money is sort of on the one is like the global economy, right? They're all like pausing a little bit on the global economy to sort of work out, okay, like what's happening there, and how's that going to shake out, and when we're getting past it. But there is a lot of investment money, and then the P model specifically. I helped go public with SDL, right? And we went to the London Stock Exchange. I've had a private funded company, owned company. I worked directly for, Shannon Balance, who owned VIA, right? As an individual, effectively an individual owner, right? And then PE. PE is a very attractive mechanism for people with asset and capital. So if you got a lot of capital, the PE model is a very interesting way to get into industries and bet your risk across different industries. And I think like the year before last, there was something like 6,800% increase in private equity. So it's like people can, if you got a lot of money, they can move it into, equity funds. And it's a very interesting way for them to get involved in industries and in specific companies and sort of fund some level of, startup or new ideas and innovation. So the available capital is very high. The global economy sort of sucks a little bit, right? And everybody, I think, is just sort of trying to work out, okay, like what's having a look. And then AI is basically sort of like in my mind, everyone's sort of waiting to sort of work out, okay, how does AI pan out? And once I know how AI pans out, I'm in. I'm ready to invest. But they're sort of looking the economy to stabilize and AI to come out with the future. And then I think they'll be back to investing. And I think for us as an industry, like we've got to look at that too. We've got to look at like, okay, like how do we, what is the right range of services and support and products that we utilize? Where do we sit in both the global economic outlook and the AI outlook? And then I think there's no lack of money available.
Yeah, one of the companies you worked for actually closed post ChatGPT announcement. I mean, Yonkers, that was in February or January when they announced it. That's kind of post the November launch of ChatGPT. All right, so any excitement, projects, initiatives upcoming at ULG this year, next year? Anything you want to share?
Outcomes is everything for us. So outcomes, AI, and it's just super, super vague, but you can imagine why. But outcomes and AI are very, very interesting for us. And I see the two as very linked to be able to drive us forward. We got into a medical claims thing, which is a good example where we do medical claims. It was always a translation request. We use 6 different AI technologies on the medical claims. It's no longer a translation request, is now a data process request. And so we still use translators to do, to sort of oversee it, but it's radically less. And it's gone from $120 to process a medical claim to about $25 to process a medical claim. And so it's, there's opportunity in terms of, how you can use AI and sort of shift the nature and focus, because the point of the medical claim was nobody wanted a really nice flowing translation of a medical claim, but it was like, I do need it into English or into French or whatever the target processing language was. But in reality, what I want to do was just confirm that you'd had a certain type of procedure, that it cost a certain amount. And I just really wanted the data out of it. So I used the translation as a proxy to get the data. AI has been able to come in and replace that. And so now we use sort of an AI platform to do, a significant portion of that work. Or actually, it's not one platform, because you have to do kind of optical character recognition. That has its own thing. You do language recognition, like that has its own thing. Then you use a neural machine translation. So it has a bunch of different aspects in it. But I think they're the type of interesting things for us. Is how can we? That's where we're very focused. Welfare cycle is very meaningful to us. Beyond the welfare cycle, every company needs some level of outcome and engagement, and AI can drive that for us. And that's what we're pursuing. And it really makes very big differences. It's not but it's not about translating more. It's about engaging more.
Absolutely. Well, thank you so much to Portland, Nick. And it was great to have you on the podcast today.
Great to speak to you. Good to connect again. It's been a while. So nice to speak to you, and thanks for taking the time.
Thank you.